My name is Tracy Cundiff. I'm an 8th semester nursing student. It is January 15th of 2020, and today I'll be performing a central line dressing change for a patient. So you want to come into the patient's room, identify them by their name and date of birth, check their armband, introduce yourself, and provide for patient privacy before you even begin. Let them know what you're going to be doing, so let them know that I'm going to be taking off this central line dressing change here on their neck, and then placing a new sterile dressing on that. It may be a bit uncomfortable, but I'll try to make it as comfortable as possible for them. I want to wash my hands. I'm going to don a pair of clean gloves to remove the dressing that's already in place. Removing this dressing is usually the most uncomfortable part for the patient, so I try to be conscious of that and mindful. When you're pulling this dressing off, make sure that you keep your fingers close to the skin and sort of pull slowly, keeping your fingers sort of the opposite direction of what you're pulling to get this dressing off. Mindful that you don't tear skin. This is not comfortable for them. You can tear skin, you can pull hair. It's just not a very comfortable experience for them. So we try to do this and keep them as comfortable as possible. So tearing this dressing off, I want to be sure to check this dressing once it's off for any drainage. I also want to check this central line insertion site for any signs of infection. So for redness, swelling, edema, drainage, for warmth. I don't want to touch that site with clean gloves, but when you are applying the other dressing, you can sort of sense for warmth. If there's drainage on this or drainage around the insertion site, I want to go get a culture kit and swab it and send it down for culture. Make sure that you get a physician order for doing that as well. Make sure that your physician is aware that there's concerning signs of infection around that site. Once this dressing is off, I can take these gloves off and throw them away. I'm going to wash my hands again, and then you can open this sterile dressing change tray, moving it away from you, and mind your 1-inch border, making sure that we don't contaminate anything inside this kit with your bare hands. So, okay, so inside these kits there's a mask. There's two masks. There's a mask for me and a mask for my patient. So I'm going to place my mask on first. And then place your patient's mask on. You can do that for them or have them do it themselves. So they will also need a mask. And then there's sterile gloves in here as well. There's actually 2 sets in most of these kits. So I'm going to pull my sterile gloves out and get ready to don them. Okay. Making sure that I only touch the inside of this cuff. I don't want to contaminate the outside of my glove. So that cuff rolled to the inside of my skin. So I would have to doff these, wash my hands again, and place a new set of sterile gloves on since that cuff rolled and touched my skin. So the outside of the glove is now contaminated. So I would need a new set of gloves. Once you have your sterile gloves on, you can set up this sterile field. You can use the paper that's provided if you want. I'm going to throw mine away. And then you want the chlorhexidine swabs that are inside of your kit. So you open these swab sticks. And you're going to clean around this insertion site 2 to 4 inches, scrubbing vigorously for at least 30 seconds with each swab. So 2 to 4 inches, scrubbing around their insertion site. And then I would pitch that one, grab another one, again 2 to 4 inches. Whoop. Obviously that would not happen on a real patient because they would have that on. You can also have them you want them to turn their neck away from you so you can get their site nice and clean. Clean their pore. I'm going to pitch this one. And then scrub again 2 to 4 inches vigorously for at least 30 seconds. I take this last swab and I go ahead and clean down their lines as well. And I'm going to throw that away. Once that's thrown away, you're done cleaning. You want that to air dry for at least 30 seconds. It should only air dry. Don't fan it dry. Don't assist it in drying. It needs to air dry before you put your occlusive dressing on. So these kits also come with this occlusive dressing. My site's still a bit wet there. This occlusive dressing, you want to peel the backing off. This occlusive dressing also comes with a date sticker on it that you're going to want to peel off and date and initial and time when you're done here. So again, patient's neck is turned away from you. To increase your working area, you're going to place this occlusive dressing on, making sure that anyone who comes in to assess this site can see the central line to assess it. So this clear portion needs to be over your central line. These are not easy to do on the mannequins, but so peel this outer layer off, making sure that your dressing's nice and secure to the patient. And then you would date and time and initial this piece here. Peel that off as well. Stick that to I like to stick it to the lower portion of the dressing so that you can still see this site. You can then doff your sterile gloves, take off your mask, take off your patient's mask, throw them away. I can throw all of my supplies then away. I'm going to lower my patient back down to earth. I'm going to make sure that their call light's in reach, make sure that there is nothing else that I can do for them to make them comfortable at this time. There's nothing else that they need. And then I'm going to go document that I changed the dressing, my assessment of the insertion site, including whether or not it had any signs of infection, Rita, drainage that I cultured, and then the characteristics of that drainage if there was some present, and then how the patient tolerated the procedure. And that's it.